Hello, I'm Dr. Jeyakumar Janaarthanan, Consultant Orthopaedic Surgeon. Today, I'm going to talk to you about sports injuries. So, one of the two commonest joints involved in sports injuries is the shoulder and the knee joint. In the shoulder joint, very often young athletes suffer what's called an anterior dislocation. The shoulder, which is the proximal humerus situated on the glenoid, dislocates or moves forward, jumping out of its ordinary socket. This is most commonly due to what's called a Bankart lesion, an avulsion of the capsule and the labrum from the anterior aspect. This puts the athlete in excruciating pain and a deformity in the right shoulder. It very often has to be reduced under anesthesia or sedation. Patients go back to their sports but are at risk of these dislocations happening over and over again. In this sort of a scenario, it's best advised for them to consult an orthopedic surgeon, take an appropriate MRI scan of the shoulder, and have arthroscopic surgery if the MRI scan also indicates a tear in the anterior capsule and the labrum. Patients also come very often with rotator cuff tears or what's called a slap tear. Both of this also will need an MRI evaluation as well as arthroscopic surgery and treatment. With regards to the knee joint, athletes very often present with an anterior cruciate ligament injury. In short, it's called ACL. These patients complain that their knee keeps popping back and forth when they have to do a sudden pivot or sudden change in direction while running. And each time the knee sort of slips back and forth, it causes more damage to the menisci, other ligaments, and the cartilage. These patients would require an MRI scan of the knee, a thorough clinical examination, and an arthroscopy to assess the damage, and most probably an ACL reconstruction. So if you do have recurrent sports injuries, it's advisable to consult an orthopedic surgeon to prevent further damage to your shoulder or knee joint.